So this is always an interesting one to do first thing in the morning, talking about suicide risk assessment and management in primary care. And I hope for anybody that is maybe still a little bit sleepy that this, with bringing some more alertness and attention to something that is personal to all of us. When I get into talking about the prevalence, it will be very clear that suicide impacts us in some way personally and pretty regularly in the role of primary care or pediatric work. And these are pictures from local media coverage in our state, as well as a picture of the Aurora Bridge, which for a long time was known as the Suicide Bridge in Seattle, and is the site of a patient I've worked with, her plan, and a couple attempts, and I'm going to talk about her in a little bit. So my goals for today is to briefly kind of couch the importance of this work in the data that exists, and specifically in our state. Understanding and underscoring the role of screening in primary care, and hopefully the bulk of the time spent helping to develop some increased confidence that you have the tools and resources at hand to do this effectively within the constraints of your busy days in primary care. So looking at epidemiology, we know that there is an estimated over 1 million suicide attempts in children and adolescents every year, which is a pretty alarming number. There's a lot more attempts than there are completed suicides, with about 1 completed suicide for every 100 to 200 attempts among youth. It is the second leading cause of death for 10 to 24-year-olds in our state, and that actually goes up to age 34, with about 2.6 completed suicides per week in our state. Every 2 years, Washington State does the Healthy Youth Survey. This is the most recent data that I could access. What we know from this data, wrong button, is that we have over a third of our youth, grades 8 up to 12, who report that they have had at least a 2-week period of being so sad or hopeless that they stopped engaging in activities as usual. Among this same surveyed group, we have 1 in 5 youth who have considered attempting suicide in the past single year. We have 15 to 18% who have made a plan in that last year. And 1 in 10 of our youth surveyed that have attempted at least once, sometimes multiple times in the last 12 months. Also alarming is that is this trend right here. We have seen a startling increase in the rates of suicide among youth from 2016 to 2017, with a 32% increase among 10 to 17-year-olds and a 25% increase among young adults under age 20.
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.